Welcome to the Alphagenix Podcast, where every week we talk to incredible guests from around the world of biohacking, well-being, men's health, and more. Here's your host, co-founder of Alphagenix, Ross Tompkins.
Well, I'm delighted to welcome today's guest. We have Dr. Paul van der Westhuizen from MediChecks. Welcome, Paul.
Good morning, Ross. Thank you for having me.
Did I get your name right?
As I said at the start, thanks so much for that stab. I think that's probably the best attempt I've heard yet without me having to correct anyone. So yes, Van der Westhuizen, South Africa in origin, but that's a good enough attempt. Thank you.
Brilliant. Thank you. Well, it's always a good way to start, I think, is at the beginning. So who are you? How did you end up in medicine? And then we'll slowly sort of move that over to the importance of having your blood work done, which I guess is where you are now with MediChecks.
Ultimately, and I think that would be a great focus of the conversation for sure. So I suppose just to begin, I'm a medical doctor, UK trained, UK qualified. The name suggests I'm not indigenously from the UK, so South Africa would be my country of origin. And for you and your listeners, I would hope that you were cheering for South Africa as well in the recent Rugby World Cup. I'm dead excited and dead pleased for the victory. But anyway, I grew up in England, UK schooling system. Just found myself very intrigued by the idea of physiology, human biology, anatomy, and that's really what pointed me in the direction of medicine as such. I would say that I'm now at a point where I'm going to use the word studying medicine because as a doctor, I don't think you ever really stop studying. But I've been studying medicine now for well over a decade, and in addition to being a UK trained medical doctor, I'm also a fully registered general practitioner working in the UK. The other qualifications that I hold is a postgraduate master's in sports and exercise medicine, and that would be from a very prestigious university in the Republic of Ireland, Trinity College Dublin. So I feel like that's probably another domain or a facet to my work that I find interesting anyway.
Brilliant. You said something really interesting there, which was, you're still learning. And I think that's really important because I guess it's the very definition of science and medicine is that we don't know everything. And we should always be pushing the boundaries and learning all the time. But I think sometimes that doesn't always happen. And some people fall into this idea of it's my way or the highway. This is how you treat everything and that's it. And you end up with this cookie cutter sort of solution to everything, whether that's as a physio, which is my background, everyone gets treated with the same 6 exercises, or as a GP, but we're all different. And I think one of the ways that we can understand our differences is by looking at the blood. So that's a good way of segueing on to what you do in the biochemistry. So how did that come about?
I think that's a very good point to pick up on about that continuing professional development, Ross. And I'm glad that there's common ground between your background of physiotherapy and mine of medicine. I've got family members who are physiotherapists as well. So honestly, I regard you guys so highly. I think there's lots to be learned between the different professionals. But yeah, on that topic of continuing learning, since migrating into the role of working with MediChecks in the sector of digital health, wow, it's opened my eyes as to perhaps how the subtle details or intricacies with our health that perhaps would have been overlooked with mainstream or let's say more traditional ways of conducting medicine. The MediChecks format is great. I mean, our approach and our vision is we want to empower individuals. We want to empower people to be able to take control of their own health, make blood testing accessible, because everybody should have a right to be able to investigate or find out pieces of information about themselves. And we firmly believe we're able to do that here at MediChecks. Have you got much experience in even from a personal note, finding out intricacies about yourself that maybe you wouldn't have known without blood testing?
Yeah, 100%. So, I mean, my story goes back 10 years. And I started having lethargy, joint pain, apathy, and I went to the doctors. They ran some blood tests, referred me to endocrinology, and the endocrinologist said, your thyroid isn't working. Put me on levothyroxine, and I felt awful. But we kept running the bloods, and they were saying, no, you're fine. I can see on your blood test that you're fine now. And I was going, no, you don't understand. I feel worse. I said, look, I want another opinion. Eventually had 3 opinions from 3 different endocrinologists. And the last one said, it's all in your head, Ross. There's nothing wrong with you. I know my body better than you do. I've known you for 20 minutes. I appreciate your knowledge, but I feel worse. That led me on to seeking help in the private sector, which I'd never done until that point. And then I discovered there was this whole different way of looking at a blood test, from looking at the normal parameters, which is designed to capture 95% of the population, and looking at what optimal is. And that then led on to the last 10 years of really looking at what's the differences between optimal, normal, how we can influence those things with supplements, exercise, mental health practices, and ultimately medication. So it's been a long process, but that was kind of how my journey started.
Well, thank you for sharing that. And again, I recognize your listeners probably have heard. It's the first time I'm hearing that. Thank you. But if for them as well, that's so interesting. To pick up on something you said there, which I think translates again to knowing yourself and knowing when something maybe isn't functioning correctly, is listening to how something is described. So if someone comes to you and say, "Listen, I'm feeling tired," well, what does that mean for that individual? Does it mean they're lacking energy? Are they lacking motivation? Is it a more degree of genuine weakness, perhaps, in limbs? Is it a sleepiness issue? So it's those subtleties, you're quite right, that can send you off onto the whole spectrum of avenues potentially. And what we feel at MediChecks that sets us perhaps apart from other providers is we pride ourselves on having a very generalist approach. So this is where it ties in wonderfully with my background of general practice. People often ask, where's your expertise? I would say my expertise is in being generalist. And there aren't that many people that are able to, or many individuals, or specialties rather, that can pull things together from lots of different domains. And we pride ourselves on that approach at MediChecks by casting the net wide, so to speak, by being able to provide a spectrum of tests. You can cover loads of different facets for an apparent low energy as a presenting complaint that maybe the individual themselves hadn't thought about. So, yeah, 100%. Very interesting.
And you mentioned something really important there, which is, the beauty and the specialty of a GP is in knowing a little bit about a lot. There aren't many other industries or professions where, you have such a vast array of knowledge at your fingertips. So I think you raise a really important point there.
So thank you for saying that. I feel there's a lot of bad press for general practice in the media, and I think ultimately it's because we are we're finding it hard to cope with the resources that's put at our disposal, and it's challenging, but we do try our best for our patients. I still work as a general practitioner. For example, I would work in our local trust as a general practitioner in the out of hours department, so I would help with palliative care, delivery to individuals. I would also help in treating young children, babies. Wintertime is a very busy time for us. Bronchiolitis, croup, asthma attacks, these things are very, very common. But that idea of knowing a little bit about a lot, we pride ourselves on that. There's the whole stereotypical phrase of jack of all trades, but the additional part of the phrase that people sometimes forget is jack of all trades, but is what's it? Jack of all trades. Oh my goodness! It ends with oftentimes better than a master of none, or better than a master of one. So it's just the idea of a superficial knowledge on quite a lot of things can often be quite advantageous. Yeah.
Definitely, and again, I do feel sorry for a lot of the press that the GPs get, because you've got like 8 minutes or something, or whatever it is, to say hello to somebody, make a diagnosis, and then come up with a plan. It's just not long enough. And actually, I didn't spend long in the NHS as a physio for that reason. I was expected to have 4 patients in within an hour, and you just couldn't get to know someone. And to go back to something you said before, unless you can really spend time engaging with someone, you don't get to hear the language they use. Actually, as you said, language is super important. For instance, if someone says, I'm in pain, what kind of pain is it? Is it dull, deep, sharp, shooting, achy? Where is it? Because that indicates what structure could be causing it. Is it a nerve? Is it a bone? Is it a muscle? Is it a ligament? What makes it better? What makes it worse? So it really helps you to diagnose what's going on. And the same as you said, there with your example of lethargy, well, what kind of tiredness is it? And where does that lead you? And then that comes back to your labs, because then you can look for certain things when you test it.
100%. What we try to do, and hopefully with yourself or your customers that have used MediChecks, when we try to guide the customers to what potential tests they may need or may require, we start by listing some potential questions. So they may say, actually, I'm interested in wellness, or I'm taking this test because I'm worried about thyroid health, or I'm taking this test because I'm worried about or hormone health. But you're sort of guiding them down like a schematic tree diagram, so that you're then provided with relevant tests to your presenting complaint. It's not just a case of, okay, for everybody, we're simply going to provide this spectrum, because that's not how it works. There are different tests more suitable to different complaints that individuals may have. So also then when we get to the stage where the customer is in the process of selecting their test and going to the final stages of purchasing, there is a lifestyle questionnaire which we advocate all customers please fill into the best of your ability, because you're providing us with medical information that in turn can provide us to deliver a more bespoke report on your blood results back to you. So yes, it's back to that point of the listening to the customer, and we try to do that in the format of understanding the style of complaint that they have.
Yeah, really, really important, isn't it, to understand what's normal for that individual, which actually is really good time to probably talk about the blood testing as well, and this difference between normal and optimal, because ultimately I feel the numbers are arbitrary in many ways. You can say, well, at 7.9 there is a problem, but at 8 you're okay. Well, what about 8.2 and 8.1, and could there be symptoms before that? So it seems silly to have such a finite, definite line in the sand where we are going to treat you, we're not going to treat you. It has to be this subjectivity to it as well, where the clinician, the doctor, can go, do you know what? I need to know what other things going on in your life. I need to do a good subjective. I need to use the appropriate assessment tools as well to diagnose and treat at my discretion, which is what we do at Alphagenix.
Sure. Yeah. It's that clinical correlation that's really important. There are numbers, and the numbers are appropriate in the vast majority of cases. There's reference ranges for a reason, but that is for the majority of the population. There are outliers, and that's where you need to be aware. And again, take the blinkers off and think broadly about correlating with that individual symptoms. I suppose what's relevant again with your organization, and you'll be very au fait with testosterone, is you've got your arbitrary cutoffs. So, for example, you follow the British. Well, I know we would tend to follow the British Society of Sexual Medicine cutoffs. But just because somebody doesn't have a hypothetical low testosterone below 8 nanomoles per liter, but they have 8.3, maybe if that's accompanied by real troublesome low testosterone symptoms, it may actually be a need to intervene. Well, what's your thoughts on that, Ross?
100%, because of course what we can't test is how sensitive that person is to testosterone. So how good is their body at actually metabolizing testosterone inside? So some people may feel great with a testosterone of 8, other people might need it to be 28. Actually, we're all different. How we respond to hormones is different as well.
Mm-hmm. Oh, for sure. I was reading just last night ahead of today there was, and you're probably very familiar with it, there was the European male aging study that talked about the prevalence of low testosterone or hypogonadism, whichever phrase you wish to use. And I was amazed to hear that as much as 23% of men between the ages of, I think it was 40 and 79, have some form of low testosterone. And that's categorizing primary hypogonadism, secondary hypogonadism, and a combination between the two. So, as you say, an individualized approach is so important.
Exactly. And some studies even think it might be as high as 40% of that age bracket. Wow. And of course, what we also need to then consider is us guys aren't very good at going to the doctors. So it could be even higher, because we know that typically 80% of women will suffer symptoms of the menopause. Hormones are not gender specific. We both genders go through changes in puberty. We experience changes later in life. And if you think about it sort of logically, well, if 80% of women experience symptoms, why wouldn't men also experience symptoms? So it could be even higher than 29 or 40%. We just stoically typically get on with our aches, pains, low mood, low libido, and just think we're getting older.
For sure. On that topic, what I try to remind, and I'm sure you're also of that opinion, is at the same time you want to remind individuals that it's also not the end of the world. You don't want to be painting a picture of it. It's a dire, unrescuable situation if levels are low. Some people may not be aware of the low levels because perhaps they're not troubled by symptoms, so they aren't coming forward, and that's also okay if you feel okay. I'm just making the point that it's that clinical correlation, isn't it? That for some men they can manage it, but don't be overlooked if you have these. I suppose it's a tangent of the personal story you told at the start. That if you have symptoms that don't seem to be falling into a bracket and that hasn't been considered, it really should be something that should be the blanket should be taken off and one should look a bit deeper.
Yeah, be explored. And you raise a really important point there, and it's something that we definitely do here at Alphagenix. Is if a gentleman approaches us, so they want to have their testosterone checked, they're thinking of TRT. The first thing we always ask them is, are you having symptoms? Because if you're not, don't waste your money on a blood test or even thinking about TRT, and actually our doctors wouldn't prescribe it for you unless you're symptomatic. So it's a very important point, and I think some men probably after listening to podcasts or what have you, and it's becoming quite topical now, just think, I'll go and get some TRT and I'm going to feel like Superman. Well, arguably it would make most men feel better if their testosterone was elevated. However, that has to be in a controlled way. We're not taking you too high, and you have to need it in the first place.
Yeah, and it can be a somewhat misplaced expectation that it's the only problem or the only issue that can be resolved to fix all domains of one's life. And that's back to that holistic approach. It's a very important domain. We mustn't be forgetting of all these other aspects of our life. Like we mentioned at the start, we touched on the mental health. From a men's health perspective, there's also avenues like cardiovascular health, erectile dysfunction. You've got cancer health. There are these big other facets too that mustn't be overlooked.
Yeah, absolutely. And then the fundamentals, like, are they eating right? Are they getting the right amount?
Yeah, of course.
Are they sleeping well? All of these types of things as well. So if we think about blood testing, then obviously one of the obvious benefits is if unless you measure something, you can't improve it because you don't know what it is. Sure. So do you think there is an argument that we always know what our baseline is? So for instance, when someone turns 18, should you just get all your markers done and that tells you where you are and then you can track that for the rest of your life? Or is that going too far? What would you recommend?
That's a very interesting point, because what that point suggests, if we know where our baseline, where we're working from, you'd nearly know when things are going out of range for you. before it gets to a point where it is allegedly in the red zone.
Yeah.
So yeah, there probably isn't a right answer, Ross. I'd like to start by saying that, but equally there's going to be benefits and disadvantages to that. I would say a leading benefit is what we just touched on a moment ago. You learn what's normal for you from an earlier stage, and then you can let's take cholesterol as an example. You'll see when your unhealthy LDL levels are starting to creep up, and you can maybe start implementing changes to start bringing them down again. Maybe you start from an early point in your life knowing what is your testosterone baseline, and you know when things are starting to decline. Perhaps you can spot your HbA1c marker, an important marker for diabetes. Maybe you can start to identify when that's starting to creep up, and again start implementing lifestyle changes, modifications to reverse that. So that would scream to me as a key advantage to certainly, even if you think you didn't need blood tests, create a baseline and work from there. The fear always with doing too much testing, and that would stretch more widely than simply blood testing alone, is the concept of health anxiety. You also don't want to uncover issues that perhaps were never going to be problematic anyway, but now that identified issue can't be ignored, or you can't backtrack from that. So we're very mindful of that, and again, that's where as a clinician who is UK trained, a general practitioner, sports and exercise medicine expertise, this is where my values really align with that of MediChecks. We apply an ethical approach moving forward. So we've conducted in-house studies and research, which thankfully has suggested that for the vast majority of our tests, we don't seem to increase the load on NHS practice through health anxiety. In fact, many customers, for reasons alluded to earlier, are happy that certain things are uncovered earlier, because they can make those changes at an earlier point before the disease is perhaps manifesting itself in a detrimental manner. So does that help? I think that's similar to what we were discussing a moment ago, wasn't it? That's sort of your question.
Prevention is always better than cure, I think, isn't it? So, but there is definitely a fine line between having too much information, which causes health anxiety. I remember back to my physio days, and I don't remember the exact figures, so I'm not even going to guess. But I remember reading a study that said, if you X-rayed and MRI'd the whole population of the UK, using extrapolated data, 80% of over certain ages would have osteoarthritic changes. However, 90% of them have no symptoms whatsoever. So told them, oh, by the way, your knee is bone on bone, whatever the awful language that used to be used a long time ago. All of a sudden, what can happen? The knee's going to get painful. They probably favor the other side. They stop playing football, or they don't bend down to pick up their kids anymore. If you get MRI, someone's back, disc prolapses are normal as part of aging. It doesn't necessarily mean you're going to have pain.
Yes. Well, what's pathology and what's a normal part of physiology are two separate things. I remember through a lot of my medical studies, we use a term incidentalomas. And that's back to your point about MRI. If you hypothetically were to MRI everyone on the street, there'd be a high degree of incidentalomas that you would find that probably have very little clinical relevance.
I love that.
So on some level then, inevitably, if someone is going to do a baseline set of blood tests through us, they may uncover things that that was unexpected, or that they didn't think were going to be picked up. So what we do, again, this is back to us priding ourselves on fully qualified doctors all providing the bespoke blood test reports on the blood analysis for the individuals, is if we find that there's a slight biomarker abnormality in someone's red blood cell profile, we would say to them, yes, this is a bit high or a bit low, but in the context of the rest of the blood tests, actually, this isn't looking too bad and may have very little clinical relevance. We will be very honest that way to individuals too, because we do not want to promote a degree of health anxiety when that may be more negative than actually having had the blood test in the first place or not having had it.
Yeah, absolutely. And we've benefited firsthand from that level of knowledge that you guys have. Because I remember with a patient not too long ago, we had a phone call from yourself or one of your team just saying, we've just got some bloods back this person has got something wrong with their liver.
Okay.
And they need to go to the hospital straight away.
Okay.
And it was that kind of serious a phone call. And actually we were like, no, it's okay. And they're under a liver specialist already. We know.
Okay.
Okay, fantastic. But it was great to have, that level of support there from MediChecks who were like, we've seen this is out of range. Let's get to work on this together as a team. So that was brilliant.
Oh, thank you for highlighting that, and thank you for the compliment. This would be another aspect to our care that we are proud of. We always have a doctor on call, even over bank holidays, Christmas time, weekends, nights. There's always a doctor on call, such that if a result, an unexpected, highly abnormal result outside of the normal range was to come from the laboratory, we would act on that. That wouldn't be left unattended. And we do have clinical excellence guidelines as set by our medical director, Natasha Fernando, that we follow by, that if certain thresholds are met, that would so-called fall in a red flag range, if we can phrase it like that. We act on those things, and that's an example perhaps of where we did, but maybe there was we didn't know a certain part of the clinical story. So thank you for filling us in on that occasion, Ross.
Yeah, no problem. And of course we filled you in at the time, so we didn't leave you thinking what's going on here. So with blood testing then, this is obviously the central tenet of what we're talking about today. Do you test yourself on a regular basis?
That's a very good point. And I think before I joined MediChecks, I would not have been someone that would have rushed to do that. Rush is the wrong word, but who would have sought that out? We actually had a bit of a scare in our family ourselves, where a close relative of mine had a heart attack at a very young age. And it's interesting how those life moments really highlight to you the finite aspect of life. And that was a key moment that I thought maybe I should really get my cholesterol checked too. I want to make sure that some of these cardiovascular risk factors that can be identified with the blood test, that they are addressed in a timely manner. And yes, went out and got that done. Nothing detrimental, subtle abnormalities, working on it myself. I'm not perfect by any stretch, but so that's an example of where maybe before MediChecks, I don't think I would have been someone who would have been as au fait with getting blood tests done regularly. But I can see the benefit in it now for sure. And it's interesting whenever we get customers or businesses on behalf of customers, and it is very interesting reading the reasons for getting the test done. So it links back to that point initially about us providing them with a lifestyle questionnaire where they can fill in their reasons for the test. But we do have a free type section, and it is remarkable the wide-ranging triggers for individuals to seek out the blood testing. It might be like mine a moment ago. It might be a family history element that you then want to make sure you identify any risk factors that apply to yourself. It might be an odd symptom. It might be a medication use, and they want to check that their kidneys and liver are coping well with the medications they can start on. But yeah, it's wide ranging.
Yeah, and it comes back to that idea that unless you measure it, you can't change it. So armed with that knowledge certainly make things easier, doesn't it? You're a great example. With what you saw, you're now making some changes. So that could be
completely
a paleo type diet, for instance, which will help to bring those lipids down. So it is interesting, because if you hadn't have done that, you might not have made any changes, and then who knows what the future may hold.
Who knows? And that uncertainty is the thing of nightmares sometimes. But it a bit like you mentioned earlier, as men, we sometimes have a taboo about seeking out health advice, health investigations, and it's very easy to bury your head in the sand and just pretend, no, if I just don't know and I haven't checked, then it doesn't exist. But it does require you to sometimes grow that confidence and take the challenge or meet it head on, just address it.
Why do you think we struggle, us guys? Why do we bury our head in the sand?
I wonder about that a lot. Do you think there's a masculinity element to it?
I think there's a deep-rooted societal element.
Mm.
If you go back far enough, well, not even that far, men were the protectors, and we still are. Look what happened in Ukraine recently. All of the women and children were sent away, and all the men old enough to bear arms were told to bear arms. So that still is ingrained in society, and I think a lot of it probably goes back to there, where you're supposed to be seen as the strong one, the protector, the rock. So it feels almost the opposite to reveal a weakness or to ask for help. I think it probably goes back to there.
That's a valid point. Yeah, so it's a valid point. It's almost as if if a problem was to be identified, is that considered as a weakness? And it might, that's not always a nice, it's not a nice moment. But I do feel, and I'd be interested to know with your field as well, I do get the impression that there is a shift, and I can feel that shift happening, and testosterone is one example of that. But there's a bunch of different domains where you can see that shift, and men are seeking. And mental health is another really big example. Like, it's much more public, not policies, but certainly campaigns.
And acceptance probably to a degree, isn't there? Yeah, definitely. I mean, I've taken TRT for 10 years now. For the first 8 years, I didn't talk about it. I guess I was probably a little ashamed. It felt a little emasculating to have to take something extra to make me a man. This little thing is going around in my head. And I wasn't even aware. That was all subconscious, well below my day-to-day thinking. And it was only a couple of years ago when I started delving into the realm of andropause, and we had the genesis, I guess, of Alphagenix. I was like, why don't I talk about this? And actually, there still is this societal taboo about erectile dysfunction, about testosterone. It's abused. So you have the whole, gym's side of it, where people think it's just steroids and it's just for getting big. Actually, it's so much more. It is the key hormone that influences pretty much every other system in a man's body.
And the cognitive aspects of it is another huge element. I think people immediately think muscle bulk. People immediately think energy. People think increase levels of adipose when the testosterone drops. But there's the whole mental element that's so, like you mentioned, brain fog, I recall at the start of the conversation. Brain fog, cognitive difficulties, challenges concentration. So some people, it's like maybe some dizziness symptoms. It's wide-reaching the types of symptoms. Yeah, for sure. I'm trying to think of of recent examples with us at MediChecks. So with that approach, that we come with a generalized investigation tactic for individuals. They may come to us with low energy. They may come to us with brain fog. And for many individuals, testosterone doesn't really spring to the forefront of their mind, but we do include that in a lot of our comprehensive blood test panels. So one of our most popular one, especially among men, is called the Advanced Well Man blood test. And in that blood test, we cover key organ functions like kidney function, liver function, thyroid function. We also make sure cardiovascular risk factors are looked at, so your diabetes, so HbA1c, and also your cholesterol profile. But we do include a testosterone. It is a total testosterone. So perhaps if an issue is identified there, you may benefit from then also looking at your free testosterone, your sex hormone binding globulin, LH, and FSH. But we do include a total testosterone value because not everyone thinks about testosterone as a symptom. For something that's been bothering them for a while.
Yeah, absolutely. It hasn't been really delved into in any detail in the mainstream, I guess, until very, very recently. And you could even say within the last month or so, we've seen an upturn in the amount of people that are talking about it. But still, when the typical gentleman out there thinks about testosterone, they just think about muscle, libido.
Libido, of course, yeah.
and that's it. They just think of it as a sex hormone as opposed to a key hormone for cognitive function, bone density, muscle mass, energy, mood, all of these other things.
Completely, yeah. And that would be one aspect of, for me, on a personal note, I've got my NHS work, which I do as a general practitioner, but working as a digital health clinician in MediChecks, it has opened up, though, back to that point of lifelong learning. It's opened up those routes of investigation for things like testosterone, which aren't as heavily focused on within the NHS. And I don't think it's the fault of the NHS. I think it's back to the resources being pumped into it, because what you have is we've got terrible cancer waiting lists at the moment. People can't get a face-to-face appointment with their GP, and on vast majority of cases, long waiting lists to be seen by specialists in hospitals. So inevitably, it'll be the clinical need, the severity of the clinical need would dictate how soon people need seen. And sometimes a low testosterone may be pumped to the bottom of the priority pile.
Yeah, and of course, most doctors haven't ever been taught about the andropause. I think most doctors I speak to say maybe they had 5 minutes at university at a certain point, actually going into what the andropause was. So it's easily missed as well if it does pop up in a test.
Certainly, if you look at back to the BSSM guidelines for the certain cutoffs for thresholds for treatment and where you expect symptoms to pop in, that is new knowledge to me since working with the MediChecks. It isn't. To be fair, though, from a medical perspective, it is also a duty to be a continual lifelong learner, and this would be an example of something I've learned. I do want to also stand up for medicine. we do have good teaching on hormone axes, on negative feedback loops, so we're familiar with, I suppose, the general physiology and how it works and how it operates. But certainly when you start thinking about a differential diagnosis approach, testosterone as a cause would certainly be lower on the list of things that spring to mind. Ultimately, because you don't want to be missing a heart attack, you don't want to be missing a pulmonary embolus, you don't want to be missing some of these kind of immediate life-threatening things too. But no, I take your point on board, and I certainly am proud that I know more about it now than I used to, for sure.
Yeah, I love that. So has your NHS practice changed since your involvement with MediChecks?
Completely. Yeah. There are certain things that I'm proud that I've always done and will continue to do. And if it's on a kind of communication aspect, if it's to look after the holistic health of an individual, I've always done that and I continue to do that. But certainly hormone health is a big one. And we at MediChecks see a lot of individuals who track their thyroid as well. So familiarity with how the thyroid profiles can be subtly abnormal, but actually translate quite significantly to symptoms being worse. Those would be examples of where MediChecks has been hugely complementary to my NHS work. And it's because here we give the blood tests, in my opinion, the attention it deserves. So it is a huge part of investigation. It's a huge part of finding out information about yourself, and it shouldn't really be rushed. So at MediChecks, we give it the time it deserves. And that's why we provide all our customers, as long as they've not selected the express route, we provide all our customers with a bespoke written report that they can then refer back to. It's not a case of leaving the consultation room and forgetting what's been said. They've got that information to refer back to as well.
Yeah, and I guess that's really good for avoiding health anxiety as well, because otherwise you get a blood test, all of a sudden maybe some things are in red, they're out of range, but you don't know why, and maybe you've got to wait a couple of weeks to get in with the doctor, and the whole time you're worrying. Where with what you're providing, actually you can give them that confidence that that's nothing too serious. They can change it with diet or that type of thing.
Yeah, and we try to do it in a fast way as well. We'd like to think our turnaround times are some of the best in the business, and it means that period of uncertainty from when you've taken the blood test and you're anxiously waiting for the results, hopefully that's minimized. So we try to focus on that as well.
Yeah, absolutely. And obviously, you guys do quite a lot of our testing, and we've never waited very long, so I can testify to that.
Oh, thank you.
So you mentioned a couple of times about cancer. It's popped up just indirectly with a couple of the conversations we've had.
Yeah.
What do you think about this new idea of cancer screening? I seem to be seeing it more and more now. Obviously, there was that whole debacle in the States a couple of years ago, and the lady's gone to prison now, hasn't she? She told everyone that she could diagnose any cancer with a single drop of blood, raised about. Raised about 500.
I'm happy to be told. I'm happy to find out.
I can't remember the name of the company, but she raised about £500 million or something in investment. She said she'd invented this machine that could test you and predict any cancer you were going to get, and then she just stole everyone's money. But she's gone to prison, I'm fairly sure, and hopefully someone on this video will post underneath it what that was called. But quite extraordinary. But I think since then I have seen a few more tests popping up where they can screen you for cancer. Is that something that MediChecks are going to do?
It's a good question. It's not an area of expertise of mine. I'd like to start by saying that as a disclaimer. So oncology and cancer screening is a very important topic that does require the right knowledgeable individual to give advice on that. But that being said, where it overlaps with MediChecks is especially from a men's health perspective, you think about prostate cancer. That's a one that's high up on the mind when you think of men's health. So from a prostate cancer perspective, we know about markers like prostate-specific antigen or PSA, and we do offer that. We, again, from an ethical perspective, we're very clear to customers as well, and we have, I'm happy to talk about that in a moment as well. We've got what we call a health hub on our website, where we have very helpful life and wellness articles as well. But we do have articles relating to PSA that explains to individuals that it is a good marker for picking up prostate cancer, and often you can pick up prostate cancer before it starts showing symptoms by identifying your PSA levels, but it doesn't replace a clinical consultation. So as a general practitioner, I'm very aware with how you assess prostate cancer, and it's very much a triad. There's the history, there is the prostate examination itself, very undignified, quick though, but undignified. And then you've got the blood test component. Sometimes there's a urinary test one needs to do as well. So it's just important from any cancer screening perspective that one knows where the test falls in the context of the whole assessment, so that there can't be, so that you're not unfairly placing all the confidence on that single component and forgetting about the other vital parts. I suppose that's a relevant aspect of your question to MediChecks.
Yeah. It's a notoriously tricky test, isn't it? But both PSA is often out, but should never be ignored. A DRE as well, the undignified that you mentioned as well. Again, that's notoriously poor at actually picking things up. There's been a lot of studies done there. Exactly. But when you combine them along with the subjectivity, it means perhaps then we take someone forward to a biopsy or and actually discover something useful. So it's part of that whole diagnosis.
Completely. And I recognize that's only one example of a cancer that we're talking about, but it is a well-known one. And with PSA, it can be elevated for a whole range of reasons. So again, we're honest with our customers and telling them that in the first instance, maybe you want to repeat this, because that might tell us if this was simply a transient finding due to a range of physiological reasons, such as even ejaculating the day before. That can lead to a falsely elevated PSA level. Highly strenuous, vigorous activity in the days leading up to blood tests for PSA, that can lead to it being falsely elevated. So it is important to be aware, as you say, of those false positives, so to speak.
We've had a few people over the years where, despite the fact, we obviously give them guidelines. So don't have sex the night before, don't do any strenuous exercise if you lift the day before.
Okay.
Occasionally someone will do everything. They'll run a marathon or come back, have sex, and then have a test, and then they're like, everything's gone crazy.
Very good. Yeah, that can make it difficult waters to navigate in those scenarios. Then,
absolutely. But as you say, these are all really important things to be aware of, so you can understand that information that's coming back. You mentioned something interesting before, which was about the hub that MediChecks have. So that might be a really good thing to finish with. So perhaps if you can give us a bit of information about what's on there, how people access it. Over to you.
Gladly. And thank you for the conversation so far. I think we've covered, again, even if only superficially, but on a bunch of different topics, which has been nice. And hopefully this is enough to get people thinking. On MediChecks, so the foundation of our service is blood analysis direct to the consumers or direct to businesses on behalf of consumers. And we're always trying to deliver fast, accurate, reliable, and ethical investigations to customers and empower them to better health. But to help them on that empowering journey, we have a component called the Health Hub on our website. And the Health Hub is full of an ever-expanding library of health and wellness articles. So we try to keep it topical. So if we identify that there's something that's bothering people in the public, let's say around Christmas time, it might be winter blues, it might be around antibody levels associated with thyroid disease. We try to keep it topical, and if we identify gaps, we make a conscious effort to produce public health information on those topics. And recently, ones that I've been involved in are to do with liver function tests to help make sense of them for customers, because subtle abnormalities are often identified, even if they are only incidental. We've got a whole library of articles to do with testosterone and men's health, and again, that would run in parallel with a lot of the information you've already shared so far during the talk on testosterone. But I would encourage individuals, when they're on our website, do have a look at our Health Hub. It's free of access, it's very informative, and for many individuals it offers great benefit.
Brilliant. Well, Paul, I've thoroughly enjoyed our conversation. Hopefully people are listening and they're thinking, where do I get my bloods checked? They're going to come to MediChecks now. People will be Googling this, but we will put links, of course, on this when it goes out. But yeah, I've genuinely enjoyed the conversation. Thanks for sharing all of your knowledge and wisdom about checking your bloods, and hope you'll speak again soon.
Ross, thanks so much. You've been a gentleman. Have a good day. Thank you.
Okay. Bye.
Thank you for listening to the Alphagenix Podcast. Make sure to subscribe to the channel so you don't miss next week's episode. For more resources on Alphagenix and men's health, visit alphagenix.co.uk. Until next time.